With its earliest references dating back to the 1800s, and with early educational programs and advocates since the 1940s, art and music therapies have been around for quite some time. These therapies have been used on military veterans, adults and children on the autistic spectrum, people who have been diagnosed with Alzheimer's disease, and in response to crisis and trauma. These therapies are used as another form of treatment than going to seeing a traditional psychologist or therapist. Art and music therapies are found in schools, hospitals, wellness, and senior centers, not only in the United States, but across the globe as well. These therapies are used not only to boost creativity, but aid in pro-treatment of certain disorders and conditions. However, the majority of art and music therapies are not covered by health insurance, and today I'm going to discuss why art and music therapy should be covered by health insurance. The reason why I chose this topic is because I am a recipient of art and music therapy myself, so I personally know the benefits that this can have on another person. And unfortunately, my family and I also know the financial burden this can have on an individual who is not covered by their health insurance for art and music therapy. For you to understand my topic a little bit better, I'm first going to explain what art and music therapy is. Then I'm going to discuss the medical benefits of art and music therapy. And finally, I'm going to discuss how health insurance works with mental health services. So, what is art and music therapy? According to the American Art Association, art therapy is a form of psychotherapy involving the encouragement of free self-expression through painting, drawing, or modeling, used as a remedial activity or an aid to diagnose. These are used as a form of expression and communication with other patients. Now, the reason why this is done is because the majority of patients who use art therapy already have a difficulty communicating. So sometimes the patient can't even talk at all, and the only way for them to communicate with others is to draw or paint something or model something out so somebody is able to comprehend what they are trying to say. This approach is also used to treat trauma, addictions, grief, anxiety, and stress. On the other hand, music therapy is the skillful use of music and musical elements used by an accredited music therapist to promote, maintain, and restore mental, physical, emotional, and spiritual health. There is an assessment that the accredited therapist does based off of the strengths and needs of the patient, and through that treatment they are able to determine whether they should create, sing, dance, or listen to music. These are used to aid in current diagnosis of the patient in creative ways to help them combat their disabilities and ailments through expression. And these music and art therapies not only increase the way that we are able to be creative, but they also have medical benefits that go along with them as well. So, from what we already know, art and music therapy is used as a form of expression or communication with patients. And this is where they use different mediums to convey emotions that may be difficult for them to put into words. According to Claricode.com, art therapy patients enjoy numerous benefits from their sessions, such as improvement in mood, resolved conflicts, a sense of personal fulfillment, and improved self-observation skills. Other benefits include reduced stress, and it also may help patients better cope with pain. The reason why they are able to see an improvement in mood from the majority of the patients is because, like how I said, they already have a difficulty trying to communicate already. So once they are capable of showing their feelings and expressing the way that they have felt, or being able to finally say something that they haven't been able to say, it dramatically increases their mood. Music therapy is used to improve the quality of life for patients. This is done through singing, listening, or writing music. It helps with motor and communication functions, and the treatment is often seen with people who have developmental and physical disabilities or sensory impairments. Claricode.com states this form of creative expression also helps people with medical conditions such as cancer or brain injuries, and it is even sometimes useful for women in labor. Additional benefits that are associated with music therapy include the reduction of pain, loneliness, and stress, as well as improved feelings of self-esteem. So art and music can be used not only for enjoyment, they are also used to visually and mentally stimulate somebody. There are a multitude of benefits the recipient can get from treatments with art and music. Now, there is a possibility for most health plans to apply similar rules to mental health benefits as they do for medical and surgical benefits. Most of the time, though, it is not full coverage, and it is because mental health is still considered a gray area, and art and music therapies are predominantly used for people who have mental health disorders. The majority of insurance plans have to cover mental health benefits. According to mentalhealth.gov, as of 2014, most individual and small group health insurance, including plans sold on the marketplace, are required to cover mental health and substance use disorder services. The coverage must be essential for benefits, and services must not be restrictive, but that doesn't mean all services will be fully covered or covered at all. And this is where an individual is really going to have to do their research in what their medical insurance properly covers. And that's where you look at the enrollment plan's materials, look at the coverage levels for your benefits, and this should include a mental health category if there is one. Mentalhealth.gov states, because of the Affordable Care Act, health insurers are required to provide you with an easy to understand summary about your benefits, including a mental health benefits section, which should make it easier to see what your coverage is. So in conclusion, art and music therapy should be covered by health insurance completely. I discussed what art and music therapy was, the medical benefits of art and music therapy, and how health insurance works with mental health services. Today, art and music therapies are still considered alternative therapies, regardless that they've been around for decades. Mental health is on the rise, and with technology advancing, I believe they should be treated the same as insured therapies. Paying out of pocket should change because people with disabilities and impairments should be given a multitude of options for treatment. The solution to this is to fully cover art and music therapies through treatment.